Good morning. This is David Henry. I'm the Communications Manager for the City of Amarillo. I want to welcome everyone to the weekly news conference for the latest in COVID-19 information for the Amarillo community. Once again, we do these every Wednesday at 11 a.m. Let me go ahead and briefly introduce who is on our panel today. We're joined by Amarillo Mayor Ginger Nelson, Casey Stoughton, Public Health Director for the City of Amarillo, Dr. Scott Milton, Public Health Authority, Texas Tech University Health Sciences Center, Dr. Brian Weiss, Chief Medical Officer for Northwest Texas Hospital, Dr. Michael Emmentier, Chief Medical Officer for BSA, Dr. Rodney Gonzalez, Director of the Amarillo VA, and City Manager Jared Miller. We'll go to our panel to make statements, and then we will take questions from our media who are in attendance. We'll start with Amarillo Mayor Ginger Nelson. Mayor, how are you today?
I'm well, Dave. Hello, Amarillo. I hope you're somewhere warm. I have a beautiful picture out my window here watching it snow. On this February 10th, I want to say happy birthday to my mom. Yesterday was her birthday, and she watches this every week faithfully. So glad to be able to do that. We do have good news in our community, and I think good news builds hope. And with hope, we can build endurance in our tank, I think, as we begin to see the end of this COVID situation in our community. But we've got to finish our race strong. I've had some questions, especially from business owners, about what is expected of them now that we are no longer a high hospitalization area. Are masks still required? And the answer is yes, masks are still required inside your businesses. And that is because of the governor's order. So there is state law that backs enforcement of that as a business. And I want business owners to be aware that those laws are still touching their businesses and the customers that go into those businesses. So together we can all do what needs to be done to finish COVID and get our community across the finish line. And wearing masks is part of that. I also have had questions from citizens about events. We've held off on events for so long: weddings, funerals, birthday parties, fundraisers. I know nonprofits in our community have been highly affected by COVID and the fact that we're not gathering, and it makes it difficult to do fundraising. At this point, we are still at level red in our city. And while our hospital numbers are better, and we're thankful for that good news, and we're no longer an area of high hospitalization, we're thankful for that good news, we are still on the cusp of, if we shift off of the behaviors that we've been doing to get us to this point, we'll slide right back into a problem in our hospitals and being an area of high hospitalization, which then affects our local businesses. It affects our restaurants and it affects our local bars. They cannot be open, and our restaurants have to decrease the amount of people that they can hold at any given time. So I want us to keep in mind that we are beginning to go back to normal, but we need to do that with wisdom. And we can't just do it with abandon of everything we've learned how to do in the last 9 or 10 months. So I'm asking you, if you're in charge of planning an event, would you plan it socially distant? Would you cut back on the number of people that you would normally have in this event? And would you please ask people to wear masks the entire time? So plan your event so that they can wear the mask, that food's not being served, or again, just make the changes necessary to help us for a few more months to keep our city safe and to respect the healthcare workers. And I don't know about you guys, but more and more in the last couple of weeks, as friends, and even this morning, I heard of a family member who is in the hospital with COVID. And I just, it's hurting my heart even more, because we're right here at the finish line. And if we can just get everyone vaccinated, we'll be in a place where we aren't telling those stories anymore, but we're returning to normal. So we need your help to do that. I want to let you know too, just how things are going in our relationship with the state, and Casey will have more information on this. But again, the state determines how many vaccines are sent to our city every week. And they make those allocations, and we're grateful for the vaccine that they're sending us. We just have to wait and watch to see what our allocations are going to do. And we do a lot of talking with the state as well about what we hope to get from them and who we hope to be able to vaccinate with it. Right now, we're vaccinating classes 1A and 1B. There are a lot of questions in the community about, how deeply have we gotten into our 1B population, and when will there be a 1C or whatever the next category is. And we don't know the answers to those questions. What we're doing is just vaccinating people as quickly as we can with the supply that the state sends us. There have been some questions about, could we vaccinate teachers in our community? And of course, we think that is a great idea. We've had that conversation with the state. We're still engaged in that conversation with the state. But what we know is that we cannot do anything that would jeopardize the supply we get from them. So we want their blessing, so to say, and we want to be doing our vaccines in a way that's pleasing to them so that we continue to get supply from them. We have had some great partnership in our community as we've been doing the vaccines, and hospitals have helped us. Texas Tech has helped us. Even this week, I wanted to especially call out and thank the VA and Dr. Gonzalez, as they shared some vaccines with us to cover second doses, and we're able to continue doing that day after day and not have a gap in giving our second doses while our shipment was delayed and it's now here. So Dr. Gonzalez, thank you very much for that help and reaching out to help the clinic on that. This is still an ever evolving situation, so that we're making changes both at the clinic and even in how we report information. Casey's going to talk about some changes to our report card. But I wanted to just say again, thank you to the Public Health Department staff. They continue to work hard, work long hours, and stay in front of these changes so that we as a city can be safe. And Casey, we really appreciate your leadership and the work that your team does to do that for us. So, Dave, that's all I have today. Thanks.
Thank you, Mayor. We now go to Casey Stoughton, Public Health Director for the City of Amarillo. Casey, how are you?
I'm well, Dave. It is cold this morning. We've all put our coats on and are very excited to be serving our patients this morning with vaccinations. As of yesterday, there were a total of 32,594 total cases of COVID-19 reported in Potter and Randall counties. 16,644 cases in Potter County and 15,950 cases in Randall County. We have a total of 30,175 recoveries, and we are up to 651 deaths here in our community. 1,768 active cases. Each of the cases do represent a unique individual. The total rolling 7-day positivity average for Potter and Randall counties is down to 4%, and the positivity rate at the drive-through testing site is at 22%. The 5-day the new positive case average 72 cases per day. Yesterday, our GA32 hospitalization percentage was at 8.75%. That means that 8.75% of all hospitalized patients have COVID-19. Our RAC region is no longer considered an area of high hospitalization. However, as the mayor said, it's critical that we continue to wear our masks, social distance, practice good hand washing, as the hospitalization rate and infection rates are fragile and depend on our choices to remain low. Locally, we're still in status level red. We reissued a status level red last Wednesday for another 2-week time period, as 3 of the 4 indicators were in that status level red zone. We will continue to monitor the indicators and reissue status level next week as appropriate. So depending on what those indicators are, we'll either reissue another red or we'll go down to orange. So certainly stay tuned next week. On the 2:30 report card today, not only will the numbers be updated, but you'll also notice a change that I want to take a moment to describe. In order to better illustrate this current situation, we have removed the total cases, the total case line from the graph. This change allows us to better provide clarity on the active case trends. Total cases will never decrease because it's a cumulative case count. Thus, the active case count is squished at the bottom of the graph and no longer discernible. The total case count will still be available on the report card as a number, It's just removed from the line graph, so you can see the change in time over the in the active cases. So we hope that that information is helpful to you, and you'll be able to see kind of the trend in those active cases since we've removed the total case line in the line graph. The public health drive-through still remains operational. The testing, the test site, you can call 378-6300 to be screened and directed to the test site. The bamlanivimab infusion center remains open. So if you have been newly diagnosed with COVID and have a high-risk condition or over the age of 65, please work with your physician, and your physician can refer you to the public health infusion center. To date, we've seen 129 patients, and only 4 of those patients have required hospitalization. So a really great, great turnout there. As far as immunizations go, we are just giving immunizations as fast as we can. Our team has done a tremendous job, and I just I couldn't thank them more. If we're going to go through a pandemic, I want to go through a pandemic with this team. They're truly amazing. As of yesterday, we've given a total of 33,095 first doses and 13,175 second doses, for a total of 46,270 out of the received 61,950. Of the data that has been analyzed, we have 82.8% of the vaccine has gone to people who live in Potter and Randall counties, 96.4% of the people who live in the Texas Panhandle, and 3.6% of the vaccine has been given to people who live outside of the Panhandle. We have had good uptake on second doses, as we had given everything that had been shipped to us, and we were thankful for the VA's supply of vaccine this week, and then also for the state's replenishment. We received another 10,000 second doses. So we're definitely moving through those second doses. So we appreciate everyone coming back for their second dose. Remember, when you come back for your second dose, bring your card back. That certainly will help everything move a little faster, and we'll document all of your shots on that second card or on your card. Want to just take a minute to talk about what it means to be a hub. So Amarillo is one of 85 hubs in the state of Texas. And I think we may have even been one of the first. And so we're really proud to be giving vaccine. There's some agreements that we make to be a hub. One is to vaccinate people who are in the priority groups listed by the state. So currently the 1A and 1B priority groups. We also agree that we will vaccinate people regardless of where they live. And so that is another agreement that we make with the state in order to be a hub, that will vaccinate equitably, that will use all of the doses each week, and that will promptly report the doses administered to the state. And so our team not only is administering doses very, very quickly, we definitely use all of our doses each week, but we also promptly report everything to MTRAC. So definitely proud of our team, and that we are able to fulfill all of the requirements of being a hub. Want to switch gears just a minute and talk about weather. So we're definitely looking at some weather this week. It could potentially even get worse through the rest of the week and over the weekend. City staff will monitor the weather, and if the city of Amarillo remains open, our vaccination clinic will remain open. If the city of Amarillo does close operations, then the vaccination clinic will close. We will make those notifications on all of the city of Amarillo outlets, including AmarilloAlerts.com. If you're due for your second dose, it doesn't have to be exactly on that exact 28 days. So if for chance the weather does get bad and we do have to close and you're due for your second dose, it's okay to get that dose when we open back up. It just needs to be after the 28-day mark. So please continue to make wise decisions when venturing out on slick roads and slick parking lots. Safety is very important to us, and we want you to be safe when coming to the immunization clinic. That's all I have, Dave.
Thank you, Casey. Let's now go to Dr. Scott Milton, Public Health Authority, Texas State University Health Sciences Center. Dr. Milton, how are you?
I'm good, Dave. This morning, I'm going to do something a little bit different. I'm actually going to tell 2 stories. And this is because yesterday evening I was receiving some texts from Casey, and we were talking about different questions that had come up by different individuals in terms of trying to interpret, what is the right thing to do, and what have we really learned, and are these medicines sometimes that people take, are they helpful, are they not helpful, and the frustration that comes from that. And the first story that I think is really helpful with that description in terms of how science tends to evolve is the story of the discovery of penicillin. So give me a few minutes to explain that. That's an interesting story. Penicillin was discovered in 1928 by a researcher named Alexander Fleming, and the way it was discovered was that Fleming was actually a researcher for Staph aureus. Staph aureus are staph infections, right? We deal with staph infections all the time still. So it was a problem then, it's a problem now. And he actually was studying that by having staph that he had in his lab, and he was putting it on his petri dishes. That's where he was culturing it. And as most Europeans do, he went on vacation during the summer, right before he cultured his petri dishes. When he came back, he noticed that one of them had been grown over with mold. And in fact, when he looked at it, all the staph that was in that dish had been killed. So the light bulb went off, and he isolated that mold, and in fact was the first to discover penicillin. So that was in 1928-29. The problem was that he couldn't produce it in mass quantities. They just weren't able to completely isolate it, and they weren't able to reproduce it to where they could use it in an economical manner. So it was shelved. It was shelved for until the late 30s when World War II was starting to start up, and now the research turns to America. And in fact, that pharmaceutical company that took up the research was Pfizer, as in the same thing, the same company that produced the vaccine. And I think in a typical American fashion, the way this research went is they brought in a bunch of people, and they were told and instructed to go out and find mold. So apparently a woman that was working for that company went to a grocery store in Chicago, found a moldy cantaloupe, and brought it into the research lab. And in fact, that mold produced penicillin tens of thousands of times more than any other strain that they'd had. So in fact, all of our penicillin still comes from that strain of cantaloupe. So I think that's one really interesting story that talks about how science is rather clumsy. It's rather clumsy. It tends to go in jerks, and sometimes it's quick, and sometimes there's delays. And so let's think about that in terms of what's happened during this pandemic. The other concept that I wanted to talk about is another interesting concept. There's a book that I'm starting to read. It's called Dr. Golem, Golem. And if no one knows what a golem is a creature actually out of Jewish mythology. And so bear with me a minute. So it's created by man, usually out of clay and water, and it starts off very small, kind of like a baby, and it has knowledge that it tends to grow. However, it really doesn't know as it grows. It doesn't really know the extent of its strength or its ignorance. And so as time goes on, this golem tends to grow. He's always well-meaning. This golem is always well-meaning, and it can be a man. It can be the man or a woman, a form of a creature, but it's sometimes wrong, and possibly even he can even cause harm, not necessarily through anything other than his own innate clumsiness. So if you think of this in terms, if we try to put the body of science that we've learned over the last year from this pandemic in the context of what is a golem, I think it's rather actually very instructive because science is man-made and it's imperfect. But as we've gone on, we've learned a whole lot, and there's a core of knowledge that we've learned that is extremely useful. And we do know that in fact some of these drugs that are being tried, like hydroxychloroquine and ivermectin, there's really no science behind that. And in fact, there may be some harm that can be derived from the combination of those drugs. So we don't recommend that. We can't recommend that as representatives of the health department, and we won't. So I hope that's instructive, and hopefully that didn't take too much time, but maybe we can think of things a little bit more abstractly when we think of this science. And that's all I have, Dave.
Thank you, Dr. Milton. Let's now go to Dr. Brian Weiss, Chief Medical Officer for Northwest Texas Hospital. Dr. Weiss, how are you?
Hey, good morning, David. So, after Dr. Milton, I'm never going to look at a moldy cantaloupe the same way again. But as everyone else, I am chilled this morning, and I understand I will become more chilled over the next couple of days. You don't realize how insulating hair is until you don't have it anymore. Anyway, my hope is that these cold temperatures will drive this virus further south, along with all those birds in the trees at Northwest. Or alternatively, it'll drive all the humans out of Amarillo over the next couple of days. Either way, this will be better for our hospitalization rate, but it's looking better already. As Dr. Milton said, we continue to learn new things about these vaccines. And, we know now that, particularly the Pfizer and the Moderna. So we know that first dose can make a significant difference. They're saying now the first dose of Pfizer may be 50 to 65% effective. And that the first dose of Moderna may be upwards of 80% effective in terms of protecting people. And they really saw that effect about 14 days after that first dose. Now, the question is, should you get the second dose? And the answer is absolutely. Okay, the CDC continues to recommend that second dose. Now, as Casey was saying, we're told the Pfizer should be 21 days, the Moderna should be 28 days. Now they're saying that both these vaccines really ideally need to be within 42 days of that first dose to be optimized. Okay? Now, the problem is giving these second doses is a logistical problem. And that's where Casey and her team are struggling often days, because if they give 3,000 vaccines in one day, then they need to be able to predict that 28 days from then, they're going to give another 3,000 of the second dose and not give 6,000 maybe 28 days after that first one. So we try to encourage people to come at those 21 and 28 day timeframes more for logistical reasons. But we do know that if you're a couple of days late, that's okay. So let's talk about our numbers. So at Northwest, excuse me, we have 27 positives. We are at 5.5% of our licensed beds. That's great. Our total census is about 231 right now, which is kind of our sweet spot for the hospital. Right now, we have, out of the 43 people in our ICU, 13 of them have COVID. Excuse me. And of the 16 vents that we are using, only 8 of them are going for COVID patients. So that is great. Our outpatient positivity rate was at 8% yesterday. We have gone over 2 weeks where we have not exceeded 10% positivity. And even more, we've dropped as low as 3% on some of these tests. That's kind of interesting. The question is, what can we detect these variants that they talk about? One of the assays that we use, the company has shown that it will detect the UK variant. Now, it won't tell us that it's the variant. All it tells us is that there's a positive, and that could be the variant. But at least if someone comes down with that particular COVID variant, we at least know that they have COVID and it will test positive. Now, over the last 10 days in February, we've had 10 people lose their lives to COVID-19. Now, that predicts about 28 people for February total. That's not great, but that's better than the 50 that we had in January, and certainly better than the 70 plus we had in November and December. So I hope that 28 becomes a 0 very soon in the next couple months. So one thing that was kind of interesting, we celebrated the discharge of our first COVID patient. Well, the other day, we had a patient that was admitted on September 6th for COVID-19. We discharged him on Monday morning. So stunning. That is our longest patient. He's still got a long way to go to recovery, but it's a real testament to the folks at the hospital here that were able to support this man for upwards of over 5 months while he was trying to fight for his life from COVID-19. Now, in regard to our medications, remdesivir, we've given 707 treatments. We have 3 on active treatment. And just as Dr. Lamentier mentioned last week, with some insight into this medication, we're looking at the utility of it and seeing, is it really worth continuing to give, or who should we give it in particular? Bamlanivimab, we've got about 295 doses. That's the outpatient monoclonal antibody. We know that we've treated 169, either here at Northwest or through the city, with the samples that we've been able to give. And then Dr. Milton mentioned this ivermectin. I want to just briefly talk about that. Ivermectin is a medicine that we use to treat parasites like threadworms or roundworms. It turns out back in May, the Bolivian city of Trinidad distributed ivermectin to a lot of the populace there, hoping that it would protect them from COVID-19. Unfortunately, it caught on because there's absolutely no evidence that ivermectin has any utility against COVID-19. In fact, the company Merck that makes it has put that out, so we have no evidence that this is of any use. So if you're taking ivermectin, you can be confident that you are worm-free, but it will not protect you from COVID-19. Okay. And then lastly, we talk about demobilization of our staff. So right now, we had about 200 traveling staff members last week. Each week, we're going to lose about 10% of those, so that by the end of by the second week in March, we'll be about 50% of those traveling staff members at the hospital. We're really trying to pick and choose them wisely as to who can be moved on to more needy areas. And we're trying to protect our ICU, the med-surg floors, and really the ED and respiratory therapy. That's really those folks that where we still need help from these travelers. And then I think lastly, the most interesting thing I think is, so we talked about influenza and RSV. And the question is, all these things that we're doing for COVID-19, how effective are they? I talked to our lab director. We have tested over 3,000 specimens for influenza and have gotten 0 positives. Incredible. And then for RSV, which is the childhood virus, we've tested 64 samples in children with upper respiratory infections, only 1 positive. That's just absolutely incredible to know that we've been able to just knock down both those very common infections this time of year because of what we're doing. So I think the take-home message and my final message is we have to continue doing what we're doing. As the mayor said, we cannot let our guard down now. If we continue the masking, the social distancing, the hand hygiene, everything that's gotten us to this point, we will see this through to the end, where hopefully we will have 0 hospitalizations and 0 deaths from COVID-19. Thank you. That's all I have.
Thank you, Dr. Weiss. Let's now go to Dr. Michael Lementier, Chief Medical Officer for BSA. Dr. Lementier, good morning.
Good morning, David. Good morning, Amarillo. And this is a good discussion today. I find myself laughing back here to some of these comments that are interesting and also funny. I agree with Dr. Weiss wholeheartedly that the ivermectin commentary regarding any efficacy against COVID-19, needs to be really scrutinized in terms of jumping on assumptions that those therapies that have not been properly tested are effective. So please be careful in terms of people recommending therapies that have not been tested. And even those therapies, as I mentioned last week, that have been tested, there still is some concern about what the true efficacy may be. Again, because of the data coming out in trials that's really early in the setting of some of the trials that have been done, or small trials that are not powered to give us the results we'd like to see with good outcomes, we have to make sure that we're not making rapid assumptions. At BSA today, we are a total of 273 patients in our hospital, and our COVID numbers are also down significantly like they are across the city. We only have 29 patients today hospitalized with COVID-19, which is fantastic in terms of the recent reduction that we've seen in that hospitalized patient rate. Of those 29, 16 are in our ICU, and 7 of those 16 are on the ventilator at this time. We only have a total of 17 patients ventilated throughout the entire hospital, both COVID and non-COVID. We are still seeing a significant number of ICU patients at BSA, but those are mostly non-COVID patients at this time, and that we have 74 ICU patients today. Again, I said 16 of those are from COVID-19. When you look at our percentages, only 6.5% of our licensed beds are occupied by COVID patients, and that's 11% of our actual volume. That is the 29 out of the 273. Our testing numbers have been dropping steadily month after month. We are down to 6% of all tests that we're doing at BSA are positive for COVID-19. That's month to date in February. We were at 13% in January. We were at 17% in December. So that trend is moving exactly like we were hoping we'd see, which is a reduction in positives. I mentioned to the team on the phone today on this conference call, our leaders, that over the weekend we had a period of 48 hours where we had 0 positive COVID tests. So again, just showing more evidence that we're seeing less positive results. And I don't think there's a question that it's a multifactorial etiology for those reduced positives. The combination of ongoing diligence with masking, attempting to socially distance as much as possible, good hand washing, vaccinations, and then probably a little bit of herd immunity as well, as Dr. Milton and others have mentioned on this call before. So all good signs. I think it's important to mention that our city has been doing a fantastic job with vaccinations. We get asked often about, what's going on with vaccine allocation? Are we getting more at the hospital? We have not received any additional first dose allocations yet. We are out of first dose allocations, but we are getting our scheduled second dose allocations for those proper individuals, our employees, those that are 1B that we could vaccinate. And we've now administered over 4,300 vaccines at BSA. 57% of those are first doses. That is a small number compared to what we've done in the city. And I think we should continue to support those efforts at the city wholeheartedly because of the great job that they are doing. We are also working with the RAC and the state in terms of demobilizing some of those nursing staff and other professionals like respiratory therapists and physicians and CNAs. Those are nursing assistants that have been helping us through this pandemic. Our nursing leaders are working in that staged and tiered demobilization. It's going well at this time. We are concerned about holding on to and continuing support with the ICU nursing staff while our numbers remain high, and the state is certainly helping us do that so that we don't lose that support in a very rapid fashion. And then I also want to mention that there was a recent additional EUA approval that just came through this week. We're going to be talking about this on our corporate-wide P&T committee meeting today that I am involved in, and that is another monoclonal antibody cocktail. Essentially, it's the same monoclonal antibody that we already know, bamlanivimab, but now they've combined it with another word that's very easy to pronounce. I'm saying that sarcastically, esitivimab, which I think you should know it's just analogous to the Regeneron cocktail. So it's two monoclonal antibodies in one. And the important reason I want to mention this is that it appears that we're going to have another drug in our armamentarium that's going to help us with people that have early infection and that have risk factors for high risk infection, as Casey mentioned earlier on this call. So we haven't received any yet. I'm sure that the hospitals will be getting some here hopefully in the coming weeks. And that will add to our inventory of the ability of certain drugs like this before someone gets to the hospital, that we can hopefully prevent a severe infection. I encourage you must get with your primary care physician. If you have recently been diagnosed, the sooner you do it, the better. Your physician will need to be the one that directs you to one of the sites where you can get that therapy, whether it's the city site or one of the hospitals where we're doing some of this in our outpatient clinics like our BSA Urgent Care Center. So again, good signs, things are moving in the right direction. We appreciate everybody's hard work up to this point, and hopefully we're going to have a much better 2021. Thank you.
Thank you, Dr. Lemon.
Hey, Dave, can I jump in and just add a comment to what Dr. Lementier said?
Yes, ma'am.
I think it's so important for citizens, if you get a COVID diagnosis and you fit in a high risk category, you will have to probably initiate to talk to your primary care physician about getting a BAM infusion, but get one. Don't wait until you feel bad enough that you think you should go get one. This is one of those treatments that you need to go and get it on the front end for it to have the most benefit. If you wait until you're really feeling poorly, you've probably waited too long. And so don't sit back and think, I'll let someone else go and get that treatment. That treatment is for you, and it helps you because it will keep you out of the hospital, and you'll feel better within a day or two. And it helps our hospitals because it will help that you're not a potential candidate for coming into the hospital. So I just want to encourage people. This COVID virus is strange, and you may not think you're that sick with it, and then all of a sudden you are. So it's a mistake to sit back on your heels and wait a few days and think, well, if I get sicker, I'll make the phone call. Please don't do that. please, as soon as you get diagnosed with COVID and you know you're in a high risk category, please call your primary care physician and ask for the BAM infusion. You don't have to know how to pronounce it. Just say, I would like to get the BAM infusion. Who do I need to talk to do that? But don't wait. It's important to do it right away. Thanks.
Thank you, Mayor. Let's now go to Dr. Rodney Gonzalez, Director of the Amarillo VA. Dr. Gonzalez, how are you today?
I'm doing well, David. Thank you. So first, let me talk about our COVID numbers. We have 3 COVID patients in our hospital, 0 in the ICU. So both of them are on our medical surgical ward. Now, in our vaccine effort, we have vaccinated over 700 of our staff members, and about 14% of our veterans within our healthcare system have been vaccinated with at least their first dose. We do have a team going out to our rural CBOCs. In fact, today we have a team at the Dalhart Community-Based Outpatient Clinic doing vaccinations. In the coming weeks, we're also going to go to Childress and Clovis. For Amarillo, we are scheduling COVID vaccines daily. So if a veteran wants to be vaccinated, please call so we can see if we can get you into one of our schedules. We are doing these by appointment. This Saturday, we do have a COVID vaccination clinic going on here in Amarillo. And I was told this morning about 60% of the available appointments for that are still open. So I would encourage, please call, get scheduled. We'll get you vaccinated. And we have the vaccine. That's the intent, is to give all the vaccine out that we have on our shelves. Now, Monday on the holiday, we're scheduled to give dose 2 of the vaccinations that we gave on Martin Luther King Day 4 weeks ago. We are watching the weather. We understand the concern of that weather. And so we're going to keep our Facebook page updated. If we have to change and due to weather have to not run that clinic, we're going to post that on that Facebook page. So veterans who are expecting to come in for that second dose on this coming Monday, February 15th, please check our Facebook page and ensure that we are open. You know, I want to thank the mayor and Casey for mentioning what we were able to do. We have a great partnership with the city of Amarillo, and being able to offer a temporary assistance did not have any impact on our veterans, which are our #1 priority. These were dose 2 vaccinations that we weren't scheduled to give till next week. And I know the city, now that they got their vaccine, they are returning back that same quantity to us. So I don't want our veterans thinking that we were giving out vaccine intended for veterans. Our hope is to vaccinate every veteran and our employees that want to be vaccinated. And I also know that the city has been doing a great job. I have visited the vaccination center twice now, and Casey has done a great tour. As I think I've mentioned on this forum in the past, I've ran many vaccination efforts in the military with influenza, anthrax, smallpox. They are doing it right. They are doing it great and very efficiently. And so very happy with it. But I also know our veterans are going there to be vaccinated. I know that because I can see them wearing their hats, and I see them around there. And so for veterans that find that easier to get to, I do not mind you going there, and we just want you to get vaccinated. And if that's where you choose to go, just make sure you let our team know so we can make sure our records get documented with that. You know, finally, I want to mention one more thing. Dr. Weiss had talked about how those things that we are doing, wearing our masks, social distancing, staying home when we're sick, good hand hygiene, have helped with influenza. You know, I didn't get numbers recently, but late last week, I'd asked one of our infection prevention specialists how we were doing. And if I remember right, she told me that so far we have had 1 influenza case for all of our VA when we've been testing patients. So it is doing something not just towards COVID. That's not why we're not just seeing a benefit towards COVID. We're seeing a benefit for other respiratory illnesses. So I would encourage, continue to do those efforts. And finally, I'd just like to thank once again the city of Amarillo, and thank all my fellow veterans out there. Have a great day.
Thank you, Dr. Gonzalez. Let's now go to City Manager Jared Miller. Mr. Miller, how are you today?
I'm good. Thanks, Dave. I want to remind everyone the public health testing site is still open. Call 378-6300. If you want to get a test, they will screen you and refer you to the testing site. Also, if you get referred to a test, or If you want to come get a vaccination and you don't have reliable transportation, please feel free to call Amarillo City Transit at 378-3095. They will schedule that transportation for you both to the test or the vaccination and back. We want to make sure that transportation is not a barrier to people getting these vaccinations and tests that are going to be so useful towards us getting towards herd immunity. Also want to remind everyone that we're still operating under two primary governor's executive orders. First is GA-29. GA-29 requires every person in Texas to wear a face covering over the nose and mouth when inside a commercial entity or other building or space open to the public, or when in an outdoor space wherever it's not feasible to maintain 6 feet of social distance from another person not in the same household. There are some exceptions, but by far the majority of us are required to, per the governor's executive order, to be wearing face coverings when we're out and about and also in businesses. Also, operating under Governor's Executive Order GA-32, under GA-32, there is no occupancy limit for the following things, and that's essential critical infrastructure workforce, religious services, local government operations, childcare services, public or private schools, and then also a specific list of establishments that can operate with at least 6 feet of social distancing between workstations, like cosmetology salons, hair salons, barbershops, nail salons, etc. All indoor professional and collegiate sporting events are limited to 50% occupancy. And now that we are no longer an area of high hospitalization, all of our other businesses are allowed to be open at 75%, with the others be open at 50% capacity. And our county judges have all taken the steps necessary for our bars to be able to operate at 50% capacity if they so choose. We are also affected, as the mayor mentioned, by some state statutes as well. For example, Texas Code Section 341.011, and it adds to the requirements of the governor to maintain face coverings, and it utilizes guidance from the CDC. The city is also operating under a modified service delivery plan now that we are no longer an area of high hospitalization. It does recognize that we are still in condition. Very likely we will move from condition red to condition orange next week, but that is going to be evaluated as we get closer to that time. Dave, that's all I wanted to also say that if you have any questions about a department's operating posture, you want to go utilize the services from any department. If you have any questions, please feel free to contact the department. By and large, we are accommodating citizens and working with them in every way to have in-person meetings and to provide in-person services if that's something you want. But we are also providing all services virtually over the phone, through the internet, and through other means as well as setting up meetings through virtual methods where appropriate. So we're going to accommodate our citizens in every way we can now that we're in a little bit more relaxed posture. It's important to remember, though, that in every situation we need to maintain our social distancing, maintain the face coverings, do all the things that we've been doing that's been working so well over the last few months to get us out of that very terrible situation that we found ourselves in from November up until January. That's all I have, Dave.
Thank you, Jared. We're now going to go to members of our media. If you have a question for an individual panel member or the panel as a whole, that's completely fine. Let's go ahead and start with, if I'm not mistaken, Aaron Langston of KEMR Channel 4. Aaron, how are you today?
All right, Tyler, take it back in 3, 2, 1.
Okay, Aaron Langston, are you there?
Can you hear me?
Yes, Aaron, how are you?
Sorry, we were just getting out of our live part of this.
No problem.
Doing good. My first question is, yesterday during the city council meeting, it was talked about getting the message of the vaccination clinic and the vaccine out to other parts of our community that spoke different languages. What is being done to reach the group of the population that speaks something other than English and Spanish?
So we're communicating with our refugee language project and our Tyson and different community partners that have access to and relationships with people who speak various languages. We also, on Amarillo Alerts, there's lots of information in various languages. So it's certainly something that we're working on and welcoming anyone that's here in our community to be vaccinated.
All righty. And hold on, sorry, I can't read my own handwriting. Oh yes, also yesterday during the meeting, you talked about a program that is in the works to be able to basically take the vaccinations to homebound people. Can you talk about that further?
So that we're in the planning phase of that, but so there'll be more information to come, but we certainly, again, want to make sure that we are reaching, reaching everyone who we need to be able to reach. So that is certainly in the planning, and we'll have more information as soon as that program is able to be rolled out.
Alrighty. And will the city vaccine clinic continue once the vaccinations are opened up to other groups other than 1A and 1B?
So as long as we are still designated as a hub and receive vaccinations, then yes, we will, certainly be providing vaccines. As the supply increases, then, we expect that the state will, vaccine to other providers as well. That's certainly our hope. And I know the state's goal is to make sure that vaccine is available to many providers so that people have access in many different formats and different providers. So we'll certainly continue to play our role. And then as the supply eases up and more providers have access, then, that may change. The look of the clinic may change, but we'll continue vaccine.
All righty. And there's been some talk that as the RAC staffing pulls out of Amarillo, that some of our bed numbers might go down. Do y'all have numbers as to how many licensed beds y'all could be losing when that staff moves on to other regions?
Yeah, I can answer that first. So I don't, but I'll be honest with you, we are doing our best to not have that happen. So between the fact that we will be changing some of the staffing ratios back to normal staffing ratios for nurses, as well as the fact that we've been working very hard at hiring back a lot of nurses. So our goal is not to let that happen and not lose capacity as we make that transition.
Same situation at BSA. Again, we're going to attempt to get back to our normal capacity that we had for ICU beds, for instance, which is 48 beds. And we are really close to that situation now. And again, as the staff is demobilized, we are going to continue to work with all efforts to maintain nursing in those positions where needed to maintain historical ICU bed capacity.
Alrighty, and Jed also has a question.
Hi, I just had already spoke with Dr. Milton over this today, but I wanted to get Dr. Weiss and Lamentier's take on this. We've had quite a few calls into the newsroom questioning if people should be taking painkillers pre-getting the vaccine to kind of preemptively strike any pain that they may have. We did see a study that was put out that found painkillers could lower the production of antibodies and interfere with the body generating a strong immune response. I was just wanting to get y'all's take on that to see if you had any advice as to that.
Yeah, I mean, I would comment to say that I would not advise taking a quote unquote painkiller before getting the vaccination. The vaccination causes very minimal, insignificant discomfort at the time of administration. And furthermore, if there's going to be some discomfort in the subsequent 24 to 48 hours, some achiness there, then certainly it's reasonable to take something like acetaminophen to treat those symptoms, which is a mild pain reliever that would help to treat most everyone that's having either mild chills, a low-grade temperature as a result of a low-grade fever as a result of the vaccination, or mild discomfort, but certainly nothing stronger than that.
I completely agree. I think what I've been telling people, I mean, I guess the one I worried about were the anti-inflammatories, the NSAIDs, the non-steroidal anti-inflammatories, which are designed to blunt inflammation. And so you can argue that maybe that's going to alter the response of the body. There's actually Lamentier said acetaminophen or Tylenol doesn't do that, yet that will treat the fever and the chills, stuff like that. So I've been telling people, yeah, at most take Tylenol if you need something like that.
Thank you all very much. That's all we needed.
Thank you. Let's now go to David Gay of Amarillo Globe News. David, how are you today?
I'm good. Good morning, everybody. I guess the first question is for Mayor Nelson and for Casey. Mayor Nelson, in your comments to start, you talked about the relationship with the state regarding vaccines and potential and conversations surrounding vaccinating teachers as well as other groups. Is there any, I guess, ideas from the state on what those that timeline for when other individuals, whether it be phase 1C, whether it be vaccinating teachers, when that could happen in the Amarillo community?
Casey, I'll answer briefly, and then I'm going to hand it to you since you serve on that EVAP committee. We have direct access to dishes and to that committee chair, Ms. Imelda Garcia. She's been very available to us for our questions. And of course, we have direct access through Casey because she is a committee member, which is really an honor for our community and speaks well of her expertise and her reputation around the state. Those are ongoing conversations, and Casey might could give us some more insight on it. But I think they're still in the works. They don't know for sure what the next category is going to look like, which is hard for us who want more information. And we're information hungry for knowing what the timeline is going to be and who the door is going to open to. So patience, again, is just something that's being required of us in this situation. But I want citizens to know that we do have an open line of communication with the state. We have regular phone calls scheduled with Chair Garcia, and she talks just with folks in our region. So it's not like it's a giant statewide call. It's us, it's our team, and we get one-on-one time to ask questions with her. We have a call even scheduled this Friday to discuss some of that. But we recognize there is importance in how we handle this, how it goes out into the community if people are wanting to know. But it's also important how we communicate back up the channel, that we don't accidentally send the message that we're done vaccinating 1B category right now. Because as they're determining what to send us every week, we want to continue to get as much vaccine as we possibly can. So there's a little bit of balance going on in those conversations. But that's what I know. Casey, how do you want to add on to that? You have a lot more knowledge.
No, I think that you did a great job with that. You know, the conversation is still ongoing. Those that the next phase of people has certainly not been determined. There will be more conversation about that within the EVAP committee. The team is very thoughtful and absolutely wants to follow the epidemiology and make sure that we're doing the very best Texas. There's about 8.4 million Texans that fall into that 1B category. So there's a lot of work around Texas, around vaccination that needs to happen, and a lot of people who need to be vaccinated or who can be vaccinated in the 1B category. So it feels like a hurry up and wait situation for sure. But if you are in the 1B category, certainly want to invite you to be vaccinated. We, as a hub, we certainly serve not only our jurisdiction, Amarillo Canyon, the whole Potter Randall County area, but also, the Panhandle. So, and without those residency restrictions, then, we certainly want to invite people who live in the Panhandle to be vaccinated if they're in the 1B category, because we have not saturated our 1B population here in our community. So certainly want to continue to invite people who are in the 1B population to be vaccinated. And then we'll have more information as those decisions are made at the state level to share as those decisions are made as to who's next.
Absolutely, absolutely. And then I have a question for the medical professionals on the call regarding this new antibody that Dr. Lamentier was speaking on. Just a clarification: is that antibody going to be for the same group under the EUA for the BAM infusion, or is it for a different population?
It's a great question. It's the exact same patient qualifying criteria for the other two monoclonal antibodies. And in fact, the new drug combination includes one of those prior drugs, the BAM lanivimab drug. So same inclusion criteria for people that qualify, those that have comorbidities, those that are 65 and older. So that's nice to easily think about it that way. It's a similar administration period. It's a similar monitoring period after the infusion is given. And they're seeing very similar low rates of any adverse reactions or complications with the infusion, which is all good news. The other thing that they're seeing is that it appears that the combination in this new drug is causing lower viral loads of COVID-19. Whether that translates to different outcomes, I think is still yet unknown. The outcomes that we're seeing look to be very similar to the BAM lanivimab alone in terms of low hospitalization rates that were significantly lower than those patients that got placebo. So I would say that this drug looks similarly effective, same criteria for use. And it may be that if the drug is driving lower viral loads, subsequent data may pan out to show a better outcome, but we don't know that yet.
Absolutely, absolutely. So with that, because of the similarities between the two infusions, I guess, Casey, will the new antibody be considered to be given out at the city's infusion center just because of the similarities between the new one and the BAM infusion?
We'll certainly continue to work with our partners at BSA and Northwest, and if that, depending on kind of all of the requirements around the medication and I think there's still a lot of details to work out. We're open to anything and working with our partners and serving our community well, but certainly working through those details to make sure that it's most appropriate in that setting is important.
Absolutely. That's all the questions I have. Thank you, guys. Have a good rest of your week.
Thank you, David. Let's now go to Kevin Welch of News Channel 10. Kevin, how are you?
Yes, we've structured our budget this year through the work we did with the CARES funding or the funding we received last year. We've structured all of that, how we spend it, to be able to make sure that we are able to fully respond to all projected coronavirus expenses throughout the rest of this calendar year for sure. So we're in a very good position to be able to respond as long as we have to. Most employees are working back at their stations. We are still allowing work from home in specific approved situations where either we don't have the ability to social distance inside the workplace or where they can fully perform those functions from home, and it benefits the organization to do so.
Yeah, that's a great question. They're tired. They're a tough group of people, and they are thrilled to be able to take care of our community and to serve our community, but they're definitely tired. We've had a couple of nice lunch donations this week. The Big Texan, Joe Taco, Chick-fil-A. So we certainly appreciate that. It's amazing how much that helps. And so we certainly appreciate the generosity of our community. But it's, it certainly, our team is tired, but that doesn't mean that they're not going to continue in their job and continue to push through and serve well. And so I appreciate that question.
Yeah, I'd like to pile onto that too, to Casey's credit. I get email, text, phone calls every day from citizens who are so impressed with the attitude of the people at the vaccination center. And you would never know that they've been pushing for, we're getting pretty close to a year now, by the attitude that you see there. It's very positive, it's very high energy, it's very exciting. If you can make a vaccination exciting, they do it. And everybody who, I mean, I won't say everybody, I have gotten so many compliments on the team and on Casey's leadership and on just the way they're making it fun, because nobody likes to get a shot. But imagine getting a shot from a Southwest Airlines flight attendant who's giving you that pep up rah rah speech. We're getting ready to take off. People are really impressed how fast it moves, how positive the energy is in there, and that's all due to that team, that public health team, paired with a whole lot of other departments and people assisting, and then with our community assisting the food and positive energy and positive words of encouragement and thanks. All that goes a long way. But they've really maintained a very positive mental outlook as they've gone through this.
We have already modified our visitation policy to allow more liberal visitation. And again, there are some differences between visitation requirements for COVID versus non-COVID patients. But yes, we are trying to really accommodate our patients and their families and loved ones by loosening some of the visitation restrictions as our COVID numbers are declining, which we think is the right thing to do.
I say the same at Northwest. We've been actively considering that and making some adjustments. We put a single chair out in the front lobby. We may go to 2 chairs next week if things keep looking better. So, but yeah, we are the same thing. I think it's much more comfortable in terms of us being able to liberate some of those restrictions.
Yeah, so our team is looking at it. We have not made any changes yet, but I think what is important to highlight with the VA, we have our hospital, but we also have our community living center, which is a long-term care facility. Those have separate visitation rules. And so even when I make the decision to release and open up a little bit of visitation in the hospital, that will not apply to our long-term care or our CLC. And I want to make that very clear, because sometimes that gets confused and people say, well, the VA is allowing visitors, why can't I visit my loved one? And so, does that answer your question?
Thank you, Kevin. Go to David Furtado of KVII Channel 7. David, good morning.
Good morning, everybody. How you guys doing?
Good.
Good. I'm kind of start off with something that Dr. Weiss mentioned. He was talking about a test that will tell you that there's a UK strain, but not specifically that it is the UK strain. So my other question is, now that we have a South African variant as well, how does this kind of roll into some of this testing? And there are some reports that at least the AstraZeneca vaccine may not be effective on the South African strain. So are you worried about this particular strain and a possible resurgence, as we've already started to see it pop up here across the states?
I think, that's one of the reasons why it's important to be vaccinated and important to continue to wear your mask, social distance, good hand washing, all of the things that we've come to know and love are just very, very important. The testing will catch up. Eventually we'll be able to test for all of those things. It's hard to know when, but eventually that will happen. But all of the things that have been in place for so long, it's all fragile. So we just have to continue those measures.
Okay. Now I just kind of had a quick question for each of the hospitals. First off and this is simple as kind of a nod. I'm trying to compare the new formula versus the old formula to see kind of the difference in the numbers now. Dr. Weiss, you said 231 is your census total patients that you have currently in the hospital?
Yes, on the acute side. That does not include the behavioral health facility.
Okay. All right. So do you include the behavioral health in like the old formula where it was the total number of patients?
We do actually, yes, because the governor asked that we use total licensed beds. So that does include 106 of our behavioral health beds. But yeah, so that 5.5% I mentioned, the denominator is 495, which is our total licensed beds.
Okay. And Dr. Lementier, the 273, that is the, the patient's not like a behavioral thing or what have you, like Dr. White, Northwest?
That's correct. We do not have a inpatient behavioral health department, so those are all acute medical patients.
Okay. Dr. Gonzalez, how about you guys over at the VA? How many acute patients do you guys have?
We currently, as of this morning, have 19 patients between our ICU and med surge, and those would be I do not know if we get rolled in the state numbers. I just do not know that since we're a federal entity, but we have 27 beds on a normal operation basis between our ICU and med surge. 19 total currently occupied. Only 3 are COVID positive.
Okay. And Dr. Milton, I know over at Texas Tech, I'm not 100% sure if you guys have COVID patients. I assume you would, considering how stretched hospitals were. Do you guys over at Texas Tech have COVID patients now? And what is your acute patient count as well?
Well, Texas Tech doesn't have a hospital.
Oh, well, I should have looked that up. Sorry about that. I'm just trying to make sure I got all my bases covered. Now, I do want to ask the city official something real quick as well. I know, Ginger Nelson, you spoke about the mask ordinance, the governor's mask ordinance that's still in effect. Is the city's ordinance that I guess talked about fines for businesses not enforcing the mask, is that still in effect right now, or is that since kind of been lifted?
Jared, I'm going to give a preliminary answer, then I'll pass it to you. The governor's mask order is still in effect. So obviously it affects all businesses operating here in the city of Amarillo. Back in November, when we passed the mask ordinance, what we did was we took a state law and we also codified it into city code. So that state law that's still there is still affecting the enforcement of the governor's mask order. And then Jared, I'll let you speak as to what happened to the city ordinance because it had some special provisions to it. But that underlying state law, Dave, is still there.
Okay.
Yeah, Dave, the city ordinance, the COVID-19 Pandemic Emergency Measures Response Ordinance, is only in effect when we are classified as an area of high hospitalization. So that ordinance is not in effect. Now, it's important to note that ordinance took language straight out of the Texas State Statute, Health and Safety Code specifically, Chapter 3 or Section 341.011, and the 12th paragraph of that says it's a violation, and there's a fine associated with that too. So there's all the things that were in our ordinance are still in effect because it's state statute. The reason why we passed an ordinance that basically has the same language as state statute is because we wanted to make sure that everyone understood that this state statute applied in Amarillo, especially since we were in such dire situation in November. We really needed to take steps to draw attention to this, and people really responded well. But it is a violation to allow an object, place, or condition to exist inside your workplace that's a possible or probable medium of disease transmission from person to person. We basically took almost that exact language verbatim and put it into the city ordinance. So we were really just underlining it and drawing attention to that requirement. So once you have that, you shouldn't be allowing a condition to exist that allows disease to transmit from person to person. Then it's important to note that coronavirus is classified as a communicable disease. A communicable disease, the appropriate measures are stipulated in the CDC. So that's where the face coverings and the hand washing, the sanitization of frequent touch surfaces inside the workplace, et cetera, things like that are required. So yes, it is still required. It is something that we are still coaching with businesses and working with businesses. They've been very responsive when the ordinance was in effect. And now we are still doing a lot of coaching with businesses, and we respond to complaints. We have not issued any citations. And I think that's important to note. Our goal was not to issue citations, not to make money, not to make life difficult for businesses, but to do all the responsible steps that we could in partnership with our businesses to make sure that our citizens had as healthy and healthy places to go and healthy practices in our workplaces.
Okay. My other I know there was like a fine associated, with some of those citations, and now that the area is not a high hospitalization area, is that I guess the penalty of fine, those citations, are those no longer in place?
Not through the city ordinance, because the city ordinance is no longer in effect. There is a fine mechanism inside state statute. I couldn't tell you all the details right now, but we can get that for you through environmental health. What we've been doing is our first visit is always education. And we'll provide education as long as the businesses are continuing to make progressive steps. In some situations, we did issue notices of violation, but notice of violation is not a citation. And then finally, the last step would be an actual citation, which we never had to do because, like I said, our businesses have been extremely responsive to the input. They want to have a healthy workplace just as much as everyone else. So we haven't had any issues with that, and they've been very, very responsive in a positive way.
Are you worried in the future now that, at least the city part of the citation, I guess, penalty is not in place? Are you worried that we could see a little bit more relaxed, I guess, enforcement or even consciousness of wearing those masks, of those social distancing, of those COVID safety guidelines?
I think worry is maybe too strong a word, but we always have a concern that as we are doing better, as our hospitals are doing better, the way that it was messaged that that our ordinance was no longer in effect, there was a very brief period where people immediately thought, oh, good, I don't have to wear face coverings anymore. I don't have to social distance. We're out. And that's a concern. We need to make sure that as our hospitals reallocate their ICU capacities and as our RAC decreases the number of staff supporting our area, we need to make sure that people are still very cognizant. This is the tool that's done the primary tool. There's other things that have contributed as well, but this is the primary tool that's enabled us to pull out of that really high death rate, that really high hospitalization rate that we were experiencing through the latter part of 2020 and into the very first parts of 2021. So it is very important that people remember this. And so I do have a concern that people are going to think that, wow, it's not necessary anymore. I can just go and not wear face coverings and it's not going to be an issue.
All righty. I have no more questions. I appreciate your guys' time and chatting with us today.
Hey, Dave, before we Dave Henry, before we wrap up, I wanted to also touch on one of the questions that KMR had at the very start, how we're reaching out to different languages. Casey mentioned that we're working through our refugee organizations. We're also doing targeted Facebook posts that automatically translate via Facebook to whatever language they have set. We're targeting underserved and low-income zip codes through the same means. And the mayor can speak to this as well, we're having meetings with different organizations that represent minority groups so that we can reach out very specifically and in a very targeted way to those populations to encourage them. These vaccinations are for you. We want everybody in our community who falls into categories 1A and 1B to be getting these vaccinations. Mayor, I don't know if you want to add anything to that. But we estimate that we've had our targeted posts translated in more than 30 different languages.
Thank you, Jared. That was all the questions we had for our media today. That will conclude today's news conference. Once again, this is David Henry. I'm the communications manager for the city of Amarillo. We do these news conferences every Wednesday at 11 a.m. I want to thank all of our panel members who took the time out to provide this information to our community today. You're much appreciated. Thank you. And we'll see everybody next week.
All right. Thanks, Dave.